Hello, and thank you for joining us. My name is Dr. Andy Schuman. I am the Associate Chief of Staff for Education here at the Ann Arbor VA, and it is my true privilege and pleasure to welcome you to this orientation. Our goal is to provide an update related to some key information that is necessary as you're thinking about beginning your clinical experience at the Ann Arbor VA. Some of this will be centric to the Ann Arbor VA, and some will be more general to the VA system itself, which you may or may not have any experience with in prior training. This is also relevant to all health professions trainees who are rotating at any of the facilities and sites from any of our academic affiliates. However, some of the information may be a bit more specific to those coming from Michigan Medicine, and I appreciate your patience as you determine how much of this is specific to your own circumstance. First, I want to clarify what the VA is. The United States Department of Veterans Affairs is a cabinet-level executive branch of the federal government that provides lifelong healthcare services to eligible military veterans. Cabinet level means that this falls under the executive branch of the federal government, and the Secretary of the VA reports directly to the President of the United States. The VA also provides disability compensation, vocational rehabilitation, education, loans, insurance, and burial and memorial benefits for eligible veterans and their families. The VA has a motto that actually came from the second inaugural address from President Abraham Lincoln: with malice towards none, with charity for all, with firmness in the right, as God gives us to see the right, let us strive on to finish the work we are in, to bind the nation's wounds, to care for him or her who shall become and have borne the battle, and for his widow, his orphan, to do all which may achieve and cherish a just and lasting peace among ourselves and with all nations. In fact, the VA mission predates the Civil War and actually goes back to the Revolution, although it has certainly evolved over the course of our nation's history. VA benefits, as I've stated, are really coming from the beginning of our nation, and veteran-specific federal agencies were initially established in 1930 and have become cabinet level since the 1980s. In 1982, there was a fourth mission named, which is to provide care to non-veterans and civilians in national emergencies. And in fact, this played out over the course of the COVID pandemic as our facility here in Ann Arbor provided care to critically ill and other hospitalized civilians when other facilities did not have the capacity to do so. There are about 500,000 federal employees who are working for VA, and we are part of the largest healthcare system in the country. Here in Ann Arbor, we take care of more than 75,000 veterans in a 3-state region. We've been open since the 1950s, and in fact are a major referral center for comprehensive care, tertiary care referrals, and other aspects of services that are not necessarily available within VA regionally. The Kettles VA Medical Center is here in Ann Arbor. We have 100-ish acute care beds, plus a 40-bed community living center. Lieutenant Kettles, who we are named for, is a Medal of Honor recipient for leading a convoy of helicopters to reinforce and rescue troops as a medic during the Vietnam War. We rank in the top 10 of VAs across the country related to metrics including quality of care, veteran satisfaction, clinical outcomes, and other metrics including research. In fact, we provide care for more than 500,000 outpatient visits per year. One other important thing to recognize is that when you are in a VA facility and working for VA, you are on a federal facility. So even though we are in the state of Michigan, federal law will supersede state, local, and regional ordinances when you are taking care of veterans. What that means is that rules related to medical practice and care that apply to the state of Michigan, which may be true, of course, in your academic affiliates, did not necessarily apply in the same way when you are taking care of veterans on federal property. This also means that transgressions, legal issues, or other concerns that arise are federal in nature, and the rules may very well be different. I don't say this to scare folks, but rather to let you know that there are differences fundamentally of practicing medicine in a federal facility. And if and when you are concerned or unclear about what rules are or how they apply differently at your academic affiliate versus here, please contact our office or your supervisors. Our education office is well staffed. We have many folks who are here to take care of you and to help you troubleshoot, as well as make sure you have the resources necessary to provide the best care to your patients. Our contact information is listed here, as well as where you can find us. Here are some email contacts, and all of this information is in an orientation packet that will also be shared with you via web as well as via email. We do provide meal cards, which are calculated based on the length of your rotation and your duty hours. Please contact us if and when you ever need these. There's also a meal program for residents who can actually order after hours a customized tray, which is a really great service that just started a couple of years ago through our canteen. This is meant for when the canteen is closed. So essentially after 2 p.m. on weekdays, as well as on weekends. All of the information is here, and we'll make sure we share it separately as well. And here's the menu of what you can order after hours to make sure that you have a reasonable access to healthy and nutritious food while you're working here, even if there's not an option for purchase in an open canteen. Ideally, you should park in a place where your University of Michigan access will facilitate parking. So there are a number of lots that accommodate Blue Passes, for example, that are a very short distance away. There are parking spots within the VA that you can use, especially if it's after hours or there's another reason to do so. If and when this is ever necessary, please review the handout information to get all of those details. The VA offers lactation rooms. There's a number of them. Here are all the details. If and when there's ever a challenge related to either lactation rooms, call rooms, or anything else, please let us know. Computer access can be challenging and frustrating. Our office is here to make this as smooth of a process as humanly possible. There are quite a number of ways in which to access the VA network, both on-site as well as remotely, and we encourage you to make sure that you have your access at least a few weeks before your clinical rotation is to start. It's much easier for us to troubleshoot computer access issues with some foresight rather than showing up on the day of a rotation and finding out that you can't log in. So we strongly recommend that everyone come over at least a few weeks in advance to make sure that everything is working properly. If and when that is not the case, there's a number of different ways of fixing this. All of this information is here. I'm not going to dwell on it other than to provide it as a reference. Also realize that you must log into the computer system every 90 days in order to maintain access, or this will time out. And depending on how long it's been, the mitigation strategy will vary. Again, this is simply going over all of the details of what you need to do if and when you lose access and how we can help you and who to contact in order to do so. There's a number of other components of this in order to make sure that you can access all of the systems that you need, including TMS, including radiology imaging, and controlled substance prescribing. When you're documenting your work hours, make sure that you keep them updated in MedHub and work with your program in order to ensure that this is accurate. When you are working at the VA, make sure that you are doing VA-related activities, preferably on site whenever possible, and this is necessary to document. When you are working at the VA, the academic affiliate, assuming you're on a disbursement, will actually bill the VA for that time, and we need to make sure that our accounting is kept accurate and updated. When you're entering outpatient encounters in the CPRS system, please make sure that you add the attending as the signer of your note. As a trainee, you cannot be the note signer, and this is just another way of clarifying that for you. Again, all of this is provided in the orientation documents as well. Finally, when you're making notes on the inpatient consult service, make sure that you're using the correct encounter and work with your attending on learning how to do this properly, just to make sure that the system is processing the document and it will be visible appropriately to all who need it. Resident supervision is a priority of the VA, and one thing that is important to recognize is that the rules for supervision are a little bit different within VA than they are through ACGME programs broadly. One particular example of that is that PGY1 residents always need to have in-house supervision, and every program may handle this a little bit differently. If there's any questions or concerns, please contact the relevant individuals. Finally, all clinical encounters require an attestation of the supervision from their attending provider, and that can be done in the body of a note through a template or as an addendum, depending upon your and your attending's preference. We offer an online Grand Rounds service. These are meant to be broadly applicable to all trainees as well as staff and faculty taking care of veterans. They are interdisciplinary and they occur monthly on the first Thursday at noon. For those who are interested in seeing prior talks, they are all on our SharePoint site, and the videos and slides are accessible for review. In order to access the VA from off-site, there's a number of different steps that are necessary. Again, these details are here for you to be able to use. At some point, the VA system may be converting EMRs to a new Cerner-based system. This has been put on indefinite hold, and I do not anticipate this happening within our facility over the next year. However, it is important to know that this is potentially on the horizon. Privacy is very important. Please note that it is a violation of federal rules and regulations in order to take pictures or keep any personally identifiable information on your personal devices. Even if this is clinically more expeditious in order to, for example, take a picture of a clinical finding or a radiology scan and text it to an attending or supervisor, that is a violation of the Privacy Act and is not allowed. Please contact the Privacy and FOIA office with any related questions. Also note that there are very specific rules for how and when restraints are used for veterans, and please follow these rules carefully when and if you need to order restraints for patients in order to document these properly and ensure that the notes reflect the careful calculation of risks and benefits and the time constraints on these restraint uses. The VA is very much committed to DEI and elimination of any harassment based on any protected class. If and when any concerns arise, either from colleagues, peers, supervisors, patients, or anyone else, please report this as quickly as possible to anyone whom you feel comfortable reporting to. That can be your supervisor, another faculty member, myself, my office. In addition, the VA provides another reference, another resource for reporting any kind of harassment, and all of those details are here for those individuals. This reviews what the disruptive behavior reporting system, or DBRS, looks like through VA, and this is yet another way of reporting any concerns related to violence, safety, intimidation, disruption, harassment, and the like. We have zero tolerance for any concerns and want to ensure that your learning environment is safe and supportive. When providing sensitive exams for patients, please use chaperones when and if necessary. We review exactly how and why that is the case, as well as how it should be documented herein. Finally, I want to ensure that you are aware of an education loan repayment program that the VA offers, which is something that you need to sign up for during your training program, but will allow you the possibility of having up to $160,000 of qualified loans paid off without any taxes for those who are interested in working for the VA after they graduate. All of these details are here, and I sincerely suggest that you think about how this may play into your own career path and financial situation. Our education office contact information is all here. Please don't ever hesitate to reach out anytime we can help you. And we also provide quite a number of national resources in order to help you in your education within VA. Here is my contact information as well. I wish you well. I hope you have a supportive and helpful path in your education here at the Ann Arbor VA and wherever your training trajectory takes you thereafter. Good day.